My name is Cecilia Rouse, and I'm the Dean here at the Woodrow Wilson School, and I'd like to welcome you to our humble abode on this rainy day. As Princeton School of Public and International Affairs, we aim to spark discussion on cutting-edge issues of our time. Gun policy in the United States is clearly one such issue. Importantly, in organizing today's discussion, we sought to capitalize on the strengths of the Woodrow Wilson School and reframe the gun policy as a public health issue rather than as an issue about individual rights. Today's panel and discussion will do just that. It promises to be thought-provoking and fascinating. To get us started, I have the pleasure of introducing Shirley Tilghman, President's 19th president, a world-renowned molecular biologist who's not only made path-breaking discoveries in human genetics and nurtured the careers of countless young scientists, especially women, but she's also led Princeton for the last 12 years. She's led on a variety of important fronts, from neuroscience to the arts. And in fact, she's deeply committed to Princeton's informal motto, Princeton in the nation's service and in the service of all nations. So it's not surprising that she's really the inspiration behind today's conference. So it's fitting that she's going to kick us off. So please join me in welcoming Shirley Tilghman.
Thank you, Cece, and thank you all for joining us today. As Cece said, on this very rainy day, it doesn't feel so bad being inside a room with no windows when you know it's raining outside. It's a special pleasure to welcome Governor Jim Florio back to Princeton once again. Thank you for caring about this issue and being with us today. I'd also like to express my gratitude to the Children's Hospital of Philadelphia and the New Jersey Health Care Quality Institute for convening this forum in partnership with the Wilson School, as well as to extend my own warm welcome to all of our distinguished speakers who will help us understand the epidemic of gun-related violence in America today. For in the context of public health, an epidemic is what we face. To quote the New England Journal of Medicine, our nation has the most guns, the weakest gun laws, and by far the highest rates of gun homicide, gun suicide, and accidental gun death among first world countries. We are less than halfway through 2013, but according to Periscopic, firearms have already been instrumental in more than 3,600 deaths, a figure that this data crunching firm equates to more than 160,000 stolen years based on lives cut short. Most of these victims are male, and a disproportionate number are young. For like other epidemics, gun-related violence takes its heaviest toll on certain populations rather than others. But few of us can claim to be entirely unaffected. The Brady campaign to prevent gun violence reports that 1 in 3 Americans knows someone who has been shot, while all of us have seen the stories of shattered families and distraught communities that play out all too often in the news. At the very least, every taxpayer must bear the burden of medical care, social services, law enforcement, and other costs that stem from the abuse of firearms, as much as $100 billion a year. Behind the grim statistics lies a web of causes that our speakers are well positioned to untangle. The ubiquity of guns in private hands and the ease with which they can be purchased are obvious contributors. But so too are inattention to mental health, depictions of violence in popular entertainment, concentrated poverty, and political paralysis. Let me say a word about the last of those. Washington's failure to reach a consensus on the expansion of national background checks, even in the wake of last December's carnage at Sandy Hook Elementary School, suggests 2 things to me. First, and this is the message of today's forum, we must reframe the public discourse on gun-related violence, both on Main Street and on Capitol Hill. If lives are to be saved and injuries reduced, we need to approach this issue not in terms of the Second Amendment, with its hotly contested meaning and appeal to abstract rights, but in terms of concrete national well-being. Much as we have dealt with smoking in public settings, industrial emissions, or the use of seat belts and child restraints in motor vehicles. We must focus less on guns per se, on banning or unleashing them, depending on one's point of view, and more on best practices surrounding their manufacture, distribution, and use. From the vigorous promotion of proper storage protocols on the part of owners to mandatory incorporation of new safety mechanisms on the part of manufacturers, we can, I believe, reduce the threat to public health that firearms present. We must also encourage the collection of data on the use and misuse of guns and on the socioeconomic patterns and impacts associated with them. Then generously support the analysis and dissemination of these data. Here, colleges and universities, as well as private foundations, can play a critical role, especially in light of politically inspired riders that limit the use of federal funds for such purposes. My second takeaway from the demise, at least for now, of federal gun control legislation is that we must look beyond mass shootings, which, for all their horror, account for only a small proportion of gun-related deaths, and focus public attention on something more mundane, but ultimately more destructive: daily deaths and injuries involving firearms. As the author of a recent op-ed in the New York Times observed, there are communities, including some in New Jersey, where the violence never really stops. It's become so ingrained in the life of certain neighborhoods that even its victims, those who are most at risk, have little choice but to learn to live with it. Even in outwardly peaceful communities, the specter of accidental or domestic shootings is always present. This is unacceptable in a nation consecrated to life, liberty, and the pursuit of happiness, and needs to be addressed with the same determination and many of the same strategies that other general threats to public health elicit. At a fundamental level, we must accept that the problem of gun-related violence, directly or indirectly, affects us all, and that the campaign against it will not be won by banner headlines, but by education, one mind at a time. Today's forum is an important contribution to this broader conversation, one that both I and Princeton very much appreciate. It's now my pleasure to welcome Steve Altschuler, the CEO of the Children's Hospital of Philadelphia, to the podium. Steve.
Good afternoon. I'd like to thank Governor Florio for his leadership on this issue, and our partners Dave Knowlton, Dean Cecilia Rouse, and President Shirley Tillman for making violence prevention a priority. The tragedy at Sandy Hook Elementary School was the most violent act against children that I've seen in my career that spans 31 years at the Children's Hospital of Philadelphia. At CHOP, we know the terrible toll that violence takes against all children, and thus on communities, because we've seen it firsthand. In 2006, we treated a number of survivors from the shootings that occurred at the West Nichols Mine School in Lancaster County, Pennsylvania. 5 children were killed during that incident. Last year, there were more than 200 visits to our hospital related to violence. 129 children and young adults under the age of 24 died of gunshot wounds in Philadelphia last year. And gun violence is only part of the issue. National estimates estimate that more than 60% of children are exposed to some form of violence: child abuse, intimate partner violence, bullying, or community violence. More than 40% of children are direct victims of violence. These statistics are staggering. Renewing pledges to end violence is not enough. Now is the time for action. First, we need to expand the models that we know are effective. Much of our own violence work focuses on our local communities, where we have more than 50 care network locations, including 15 here in New Jersey. We offer a number of programs in the community that promote the normal development of children, and we invest heavily in this work. We have also successfully leveraged our research to create dramatic changes in policy and practice. We know that injury is the leading cause of death for children, and we seek ways to prevent it so that we can save lives. Our Center for Injury Research and Prevention has demonstrated national leadership in using evidence-based research to develop interventions that have saved the lives of countless children and teens, and to positively advance public policy on injury prevention. For example, our experts in the field of medicine, epidemiology, biomechanics, engineering, behavioral science work together to improve the design and regulation of vehicular child restraints and airbags. Over the course of the last decade, their work has influenced policy across the nation, contributing to a dramatic decline in the number of children who are injured or killed in car crashes. I have asked our center to build upon this success to generate the same level of influence on issues related to violence prevention. This will require a large investment from our institution and a few guiding principles, including the following. We will understand and prove what works while rigorously evaluating new ideas to ensure that they will be effective, and we will develop partnerships and collaborations with the community to share best practices and develop innovative new approaches. We know that when we build a scientific foundation for this work, we are better positioned to impact policy. We also know that taking a bold stance is sometimes uncomfortable and comes with risk. CHOP does not engage in partisan politics, and I consider us politically agnostic. However, our work will prepare us to take a clear stand on issues when the science and practice of medicine compel us to challenge norms and assumptions. Having an impact on policy is not a new concept for the people in this room. We have done it successfully for many years. I'm confident by working together we can help advance policies that will reduce gun violence. We are here today because we want to reduce gun violence and save lives. This is a day for us to learn from each other and share ideas. Let's make the most of it. Thank you very much. It is now my pleasure to introduce David Knowlton, who is the President and CEO of the New Jersey Healthcare Quality Institute. Dave.
Well, we're here today, really, because two of what I consider New Jersey's top policy thinkers came to the same conclusion at just about the same time, which is right after that horrific tragedy at Sandy Hook that left 20 children and 6 adults who tried to save them dead. The first is Governor Florio, an American pioneer in the fight against violence, has the wounds to show for it, and who, in 1993, received just the 3rd Profiles of Courage Award from the John F. Kennedy Presidential Library and Museum. In making the presentation to Governor Florio, the late Senator Edward M. Kennedy said that Governor Florio was receiving the honor for his powerful stand against the National Rifle Association and the shameful failure of the political system to deal effectively with the need for responsible gun control. In the ensuing 2 decades and to this very day, Governor Florio continues his effort to protect American citizens from violence. The other great policy thinker who drew the conclusion at the same time is former New Jersey Health Commissioner Heather Howard, who through her service as a top policy expert on Capitol Hill, the Office of the Governor, Governor John Corzine, and as Health Commissioner, understands the power of public health to cut through politics and effectively move both the public and policymakers to save lives. These two New Jerseyans, who I'm proud to say are members of the Board of Directors of the New Jersey Healthcare Quality Institute, came to the conclusion that now is the time to finally move issues that surround societal violence into the realm of public health. Governor Florio asked our institute to undertake this issue at about the same time that Commissioner Howard was working with the Woodrow Wilson School to do the same. We decided to join forces, and we asked one of our leadership council members, headed by Dr. Steve Altschuler, at the Children's Hospital of Philadelphia to lend their expertise. So, I welcome you to what I hope will be a different kind of commencement on this prestigious campus. The commencement of a journey that will bring an end to senseless violence. The New Jersey Healthcare Quality Institute approaches public policy as devoid of judgment as we possibly can. We tackle these issues with no horse in the race, no skin in the game, or whatever metaphor you use to say that we are independent arbiters of public health with no stake in the outcome, other than better public health. We believe that the most effective and lasting public policy comes about from that kind of approach, especially in the world of healthcare. We believe that with dialogue, men and women of goodwill can achieve consensus on even the most polarized and contentious of issues. Here's what's required to do so. The participants must be of goodwill and have faith that an acceptable outcome can be achieved. They must enter into a social contract that embraces both transparency and the pursuit of data. They must have a commitment to active listening to all sides of an issue, coupled with a belief that the ultimate solution will most likely be created from the contributions of all sides rather than the prevailing of one particular point of view. The public health model holds just such an orientation. It has addressed such value-laden subjects as sexually transmitted diseases, AIDS, HIV, alcoholism, drug abuse, smoking, vehicular restraints such as seatbelts and airbags. It has been most successful when it has not demonized any side, but sought common ground. The Quality Institute hopes to bring such an orientation to today's discussion about violence. But as I said, today is the commencement. We're in it for the long haul. It is my hope that we move beyond discussions of personal rights and focus on collective safety, for I firmly believe that this is the only path to yes. To champion this orientation and ensuing dialogue, we could not have better partners in Princeton University, as represented by their president, Dr. Shirley Tillman, and Children's Hospital of Philadelphia, as represented by their president, Dr. Stephen Altschuler. Both individuals and both institutions are renowned for their commitment to protecting, nurturing, and allowing to flourish our nation's future generations, and this is especially important for our dialogue today, since our children and their children will be the most direct beneficiaries of our success in this endeavor. Finally, enlisting the traits that our public health approach will require, I must mention a trait that has repeatedly proven essential: courage. There is no better role model for such courage than Governor Jim Florio. I'm proud that the governor is here today as a member of our Institute's board of directors, and I'm proud he's here to help us bring rational regulation of violence in our society and our state to the next level. And I'm proud to introduce him to you. Governor Florio.
Thank you very much, and good afternoon to everyone. This is a very impressive crowd. I just want to express my appreciation at the opportunity to come and to talk to you about a subject that I know is on all of our minds. By the way, I want to acknowledge the fact that Dave and the Institute are really the catalysts behind this whole gathering, so we certainly appreciate the work that they put in to this whole process. The Newtown massacre lifted the level of awareness of the American people to a subject that many of us have been involved with for a long period of time: the epidemic of gun violence. And it truly is a public health problem. The evidence of that fact will be presented to you by a whole group of distinguished panelists and speakers through the course of the afternoon. My theme is that public education is an essential component of the effort to combat the epidemic of gun violence. education is obviously important in all public health problems. I would make the argument that in this area, it's even more so, because rarely do you have active advocates for influenza or tuberculosis. That's not the case in this situation. You have got active advocates for guns and the use of and the gun violence. By the way, today in the New York Times, interesting story on the front page. I see some of you nodding your head. You saw it, talking about how the power of the NRA is such they were able to get through Congress a total prohibition on any liability challenges to them for any of the actions they've taken that have resulted in gun violence. The first thing I think we have to remember is that this is not a Second Amendment issue. The courts have been very clear, all the decisions, that there's no question about the authority to have reasonable restrictions imposed upon gun ownership, even in the types of guns that can be utilized or put into commerce. I think it's questionable, then the question then becomes, is it reasonable to say that there's something wrong with the fact that 40% of gun owners in this nation never go through any background check? I don't think that's unreasonable. The question about being unreasonable, is it unreasonable to say that we should have background checks on people who have guns? That seems to be sensible as well. I think it's necessary for us to understand that no hunter needs to have 30 or 50 or 100 rounds in a magazine when they go hunting. Again, it's unreasonable to say that someone who is on the terrorism watch list, who can be stopped from going on an airplane, can't be stopped from buying a gun. That is not unreasonable, it seems to me. Likewise, we go and spend money to provide our police officers with bulletproof vests, and then we do nothing to stop the sale of armor-piercing cop-killer bullets. That doesn't seem to be unreasonable either. 80 to 90% of the people in this country agree with the position that all of those things, all those concerns are reasonable, and therefore we have a legitimate authority to go and put restrictions in that fashion, which will do something to diminish gun violence. And yet, as we see in the newspapers, the United States Congress has not got the chutzpah to be able to go and say, we're going to debate it. Not that we're going to vote on it, we're not even going to take it up to have a debate on it. That's something that's very troubling to us as well. I want to say that the intimidation of the gun lobby has carried the day in Washington for a very long period of time. And I guess my main message to you this afternoon is that New Jersey has demonstrated what the model is to deal with that, to deal with the power of the gun lobby. When I first took office, one of the early things that we did in my administration was to pass the toughest assault weapon ban in the entire nation. It was not something that was easy, but it was done. As you can appreciate the fact, the gun lobby and the NRA were extremely unhappy about that. And they worked very hard through the next couple of years to build support for their position that the ban should be repealed. What in fact happened was they were successful. They got a pro-gun legislature elected in 1991. And in early 1992, they were successful in getting the gun ban repealed through legislation. The issue then became whether I was going to veto it or not, and I did. I vetoed the bill that would repeal the ban. That's when public education came into play. We put together coalitions of people around the state, mobilized everyone that we could think of, and got good public support. We mobilized the healthcare industry. The healthcare professionals came to us and said, this is something that really is a healthcare problem, as we're all talking about today. It's a public health problem that we have to deal with. We all see firsthand the problems associated with gunshot wounds. We had a Dr. Munez from University of Medicine and Dentistry in Newark, was the head of our whole initiative. He was a surgeon, and testified that, in fact, DOD, the Department of Defense, would send their military surgeons for training to Newark, New Jersey, to deal with gunshot wounds that they would experience later on in the battlefield. That was the situation in New Jersey at that time. We also had the educational people involved. They would testify about the trauma that children would experience when they experienced violence, particularly gun violence. It so happened that at that time, a child was shot in Paterson, New Jersey in a drive-by shooting. We mobilized the clergy. And I know we have clergy here, people here today, that went out and said, this is not only a public policy issue, this is a moral issue. And that was a very forceful component of our coalitions. And probably most importantly, we mobilized the public safety people, the policemen, the sheriffs, firemen, people out there on the front line who were the people who were the ones who most vividly experienced the problem of gun violence. We had one prosecutor who testified that he wouldn't allow the police in his city to go into certain areas after dark because the police were outpowered with more gunfire power on the part of the bad guys than the good people. The gun lobby worked very hard to go and have our ban overturned. Well, to make a long story short, what we did was to mobilize people around the issue, is it really in the public interest to have more access to Uzis and AK-47s? And as you would expect, virtually unanimously, people came back and said, are you crazy? Of course not. And we were able to get folks involved in going with events that we staged. We had op-ed meetings. We had op-ed editorial meetings with people at the newspapers. We had all kinds of events. And we mobilized people to call their legislators. And to make a very long story short, again, the fact of the matter is, when the final vote came in the state Senate, not a single senator voted to override my veto. Such was the power of public opinion. It was truly New Jersey's finest hour, as far as I was concerned. It's truly participatory democracy on steroids. It was a very, very good opportunity for us to be able to demonstrate that the system really does work. So I want to just conclude by saying that there is the opportunity to do that. I think this Newtown massacre has mobilized people's opinion in ways that we've never seen before. The NRA has embarrassed itself in some respects, even among some of its own members. Legitimate sportsmen, legitimate hunters have no interest in some of these things that are being done. The NRA position on gun violence is that what we need is more guns. We need guns in schools, we need guns in theaters, we need guns on college campuses. That is insanity. And good, clear-thinking people, even who are members of the NRA, understand that's the case. And it also raises the issue as who the NRA really speaks for, if it doesn't speak for many of its own members. I think the answer is clear. It speaks for its major funders. It speaks for gun manufacturers. It speaks for gun dealers. In a word, it's about money. It's about profits. That's not something that's sustainable and not really able to be defended in any objective forum. So we can feel very comfortable being out there talking about this issue. I'd leave you with just an observation that whenever the NRA and the gun lobby in general gets to be the focus of attention in a negative way from their standpoint, they have a tactic that they use all the time. It's called stalling, running out the clock, hoping that, in fact, people will become disengaged, and therefore they won't be involved. The counter strategy clearly is they get people engaged and informed. There is no defense to the positions that they take. Even their own members are now starting to catch on to their argument that, oh, well, even if something sounds reasonable and is reasonable, if it gets done, that constitutes the slippery slope. The next step, of course, is people coming into your home and taking your hunting rifle. That is paranoia in a way that most people are starting to understand. It is not a defensible position to take. Today is a very important day because the information that you're going to be picking up from the panelists is going to give you the help that you need to go have the facts available, to go talk with people and become fully engaged. So I commend all who are responsible for this program and wish you all well. Thank you.